Victoria came back approximately a year after we did her eyelid surgery, and she said she really didn't like her jowls. Her eyes were disproportionately good compared to her lower face, her jowls, as well as the cords under her neck. So I suggested, because she's relatively young and she doesn't need a formal facelift, we could do like a mini lift on her, which is I call an S-lift. You can think of it as a jowl suspension operation. And we do this in younger people, and we also do it in people that have had previous facelifts that have continued to age and want a little bit of a tuck-up. At the same time when we do that, we have a smart lifting technique where I take a probe with a laser on it and I go back and forth and separate the skin from the underlying tissues in the face. But we also heat up the skin, so that induces the collagen to shrink, and so it's like shrink wrapping the remainder of the skin that we leave behind after we remove off.
My name is Victoria Nicolai. I'm 60 years old and I'm married. I have 2 children and I'm a teacher with Toronto District School Board. I teach special ed behavior classroom for high school students. When I was young, I always said that I wouldn't mind wrinkles as long as they were laughter lines. But when your eye is frown, there's nothing funny about it. I was unhappy about looking older. I felt like I was getting invisible, and I always enjoyed being a bit of a head turner. I looked worried, I looked tired, and I always wanted a youthful appearance to the way I feel, young in mind and heart. Just realized one day that my inside wasn't matching my outside anymore. I interviewed 2 other doctors before Dr. Ellis, and I felt a little bit intimidated. Dr. Ellis had this uncanny talent to make you feel at ease with it. There's no pressure, no rushing. I was allowed to speak to other patients about the procedure that they had done. I also had access to pictures of patients, right, before and after pictures. I showed Dr. Ellis what I was dissatisfied with, and he explained me the procedure that would address my concerns.
The reason I did the 3 procedures together, the S-lift, smart lifting, and platysmoplasty, is because we had to deal with all her problems in her neck. It's basically one procedure, but we tied them all together. The platysmoplasty means that I sewed the 2 muscles together. The smart lifting is that we heated up the skin to cause it to shrink. And the S-lift, which is in the jowl part, we did all that. We did the smart lifting of her jowls as well. So we tied everything together to give her the best possible result with only 1 period of downtime.
All these surgeries changed my life for the better. First of all, my personal life has improved. I felt like born again. I was back to my own self. Sexy, confident, at ease in the society. And the way I see it, these surgeries can quickly generate development in the professional area.